We're talking about blood transfusions. In this section, we'll deal with the blood groups and the cross matching. There are two types of blood grouping system, the ABO system and the RH system. We'll see what these systems are, how they're developed, what are the genotypes and the phenotypes in these systems. Then we'll talk about the transfusion reactions that might occur when the blood is transfused from one patient to the other. And finally, we'll talk about cross matching as how the compatibility between two types of blood is determined. Now, first of all, the ABO system. We've already gone into the Venn diagram, so I'm not going to go into the Venn diagram again. We have discussed the Venn diagram in the previous section. The ABO system consists of three antigens: the antigen A, the antigen O, and the presence of null antigen O. So A, B, and O, three antigens are there. So this is a strongly antigenic system. These antigens are very, very strong. So this is a strong antigenic system. It occurs naturally. And they're naturally occurring antibodies to these antigens in human serum. So the antibodies, they occur naturally in the human serum. If one has one antigen, the antibodies against the other antigens are already present in the serum of that person. There are three allelic genes: the allele A, the allele B, and O. They control the synthesis of enzymes. So what they exactly do, the alleles, they are actually controlling the synthesis of enzymes. These enzymes, they add the carbohydrate residues to cell surfaces. Now the cell surface glycoproteins, they are added with carbohydrate residues depending upon the type of allele that is present in that human, in the genome of that human. As a result of which, specific carbohydrate residues are expressed by the allele A, another specific set of carbohydrate molecules or carbohydrate residues are expressed by the allele B, and similarly the absence of either A or B is represented as O. So this is how the surface of the red blood cells is differentiated in A, B, and O allelic types. Now, A and B genes, they add the specific residues. As I've talked about before, the glycoproteins on the surface of red blood cells in A has a specific set of carbohydrate residues. Similarly, the glycoproteins on the surface of red blood cells in allele type B also have a specific set different from type A that is expressed on the surface. Now in O gene is an amorph. It does not transform the glycoprotein. The glycoprotein remains in its original form. So there's neither the addition of A nor the addition of B. So O does not add any component to the glycoprotein. So the glycoprotein remains in its original state. So that is allele O. So there's 6 possibilities in genotypes. Here you can see there's 6 possibilities in the genotypes: the AA, the AB, the AO. So we have 6 different types of possibilities that can be genotypic possibilities. There are 4 phenotypes: A, AB, B, and O. So there are 4 phenotypes. The naturally occurring antibodies in serum of those lacking the corresponding antigens is already present. For example, in a person with antigen A, anti-B antibodies are already present in the serum of that patient. So this is how strong the antigenic complement of the ABO system is. Now, the blood group O is the universal donor. As we've talked about it, there are no antigens in the cells of blood group O. So the blood group O is the universal donor. There are no antigens to provoke a reaction in this case. Now, conversely, the blood group AB is the universal recipient. And why is that? It can receive any ABO blood type as they have no circulating antibodies. And why are there no circulating antibodies? This is because both the antigens, the antigen A and the antigen B, are expressing their carbohydrate residues on the surface glycoprotein molecules of the red blood cells. As a result, neither of the anti-A antigen or nor the anti-B antigen can be present in the blood, because if they are present, they'll attack their own red blood cells. So since there is neither anti-A and anti-A antibody nor anti-B antibody, so they can receive any type of blood in the ABO system. So this diagram, it summarizes the ABO system. Let's go through the diagram and see what the ABO system is. So ABO system, is. So this is a red blood cell. This is blood group A. The blood group A has allele type A. Type A allele. This is the phenotype, type A. The genetic component or the genotype can be either AA or AO. So only one type of or the A residues are expressed on the glycoprotein surface. A carbohydrate molecules are expressed on the surface glycoproteins of the red blood cells. Here you can see these are the A antigens. And in the plasma of the group A, we already have anti-B antigens. This is the blood group B. Here you can see this is the blood group B. The phenotypic component is the blood group B. The genotypic component can be either BB or BO. Now the surface shows the antigen B. The antigen B is actually the carbohydrate residues of the B type that are being expressed at the surface glycoproteins. Now this B type, this blood group or the group B has anti-A antibodies within their plasma, within their blood. Now this is the blood group AB. It has both the antigens A. Here you can see this is the antigen A in circle in pink, and this is the antigen B in a diamond shape in blue. So it has neither of the antibodies and both of the antigens. So this is a universal recipient because there are no antibodies in their blood. So they can practically receive any type of blood. Now the blood group O, this blood group O, here you can see the genotype, the phenotype is blood group O. The genotype is also OO. That's the only genotype, because if there's either A or B with the O, it becomes either A or B. So the surface glycoprotein molecules remain as such. There are no modifications, so there are no antigens in the blood type O. However, due to the presence of both the antigens, it has both the antibodies against the antigen A and antigen B. So it has anti-A antibodies and anti-B antibodies. These are universal donors because there are no antigens in their on their cells, so they can donate to all the blood groups. So this is a brief summary of the ABO blood type system. Now we have the rhesus system. Rhesus system divides the blood cells into two categories: rhesus positive, Rh positive, and rhesus negative, which do not have the rhesus gene or the rhesus allele. The rhesus allele is also known as the D allele, so sometimes we refer it as Rhd. It is also very strongly antigenic. Now it is present in approximately 85% of the populace in the United Kingdom. So it was one of the reference I could find in the literature. So 85% of people in the United Kingdom have can be categorized according to the Rh system. Now antibodies to D antigens are not naturally present in the serum. So anti-D antibodies, they are not a natural phenomena, and they are not present in the serum of the patients who do not have D antigen or the Rh antigen. Now the formation of these antibodies, it is stimulated by the transfusion of Rh positive red cells. This is an important concept. Now imagine a person with an Rh negative blood cell. like this one. This is an Rh negative blood cell that does not have Rh allele on it or Rh representation on it. Now, in a patient like this who does not have Rh on its cells, if you transfuse this patient with Rh positive red cells, what would happen? This would result in the production of anti-D antibodies or anti-Rh antibodies. Now, it is acquired during delivery of a Rh positive baby. Usually this occurs in females who are Rh negative and who are pregnant with the Rh positive baby. Now the father was Rh positive and the baby is Rh positive as well. However, the female is Rh negative. Now what happens? During delivery, there's somewhat mixing of the blood of the fetus and the mother. Now this fetal blood, which was Rh positive, it goes into the vessels of the mother, and this Rh positive blood induces the formation of antibodies against Rh positive blood, because the body perceives it as a foreign invader and forms antibodies against the Rh positive cells to destroy them. So this is how Rh positive anti-Rh antibodies or anti-D antibodies are produced in Rh negative people or Rh negative women. Now these are acquired antibodies, obviously, because they were formed due to a stimulus was given, and as a result of that stimulus, these antibodies were acquired. They are very active, very capable during pregnancy, and they can cross the placenta as well. Now, if they are present in a Rh negative mother, so what happens now? Now that pregnancy is over. Now that mother is again pregnant with a Rh positive baby. Now the Rh negative the Rh negative mother, which was pre-exposed to Rh positive antigen, has sufficient amount of memory cells and sufficient amount of this anti-D antibody or anti-Rh antibody. Now when the fetus becomes Rh positive and the mother is Rh negative, this anti-Rh antibody tends to attack the fetus, tends to attack the fetal red blood cells. And how does it attack and why does it attack? Because it perceives it as a foreign threat. This results in the death of the fetus, also known as hydrops fetalis, in a Rh positive fetus. So in order to prevent this from happening, you give anti-D antibodies to such mothers who are Rh negative and are pregnant with Rh positive offsprings. So this is how you go about it. That's a detailed topic for another lecture. However, I try to summarize it with an example so that you can understand the rhesus system better. Now, moving on to the transfusion reactions. So transfusion reactions, obviously, as the name indicates, they are reactions that occur in response to transfusion. So let's see at the figure first and we'll go from there. The transfusion reactions can be allergic. So we can see mild flushing of the face. Here you can see this is flushing of the face. We can see hives or rashes. This is a mild allergic reaction. And severe allergic reaction, we can see increased anxiety. The patient might become very anxious. There might be extensive wheezing, and there might be decrease in blood pressure due to extensive vasodilation. So these are the allergic reactions. Then we can have febrile reaction. Febrile reaction can have headache. The patient can have tachycardia, that is increased heart rate beyond 100. The patient can have tachypnea, increased respiratory rate beyond 28. Now the patient might experience fever, and then the patient might experience chills as well. So it might be an undulating pattern of fevers and chills, and the patient might become anxious or there might be anxiety. And the third type of transfusion reaction can be hemolytic. Now, hemolytic transfusion reaction, as the name implies, are caused due to by the hemolysis or destruction of the red cells. So there can be decreased blood pressure, there can be increased respiratory rate. Now the blood pressure is decreasing because there is extensive destruction of the red cells. There is increased respiratory rate as a result of compensation. There can be hemoglobin urea due to extensive destruction of red blood cells and hemoglobin being released in the urine. There can be chest pain due to hypoxia to the cardiac muscles. There can be apprehension. Apprehension is a feeling of anxiety that develops with lowering blood pressure. There can be low back pain, the fevers, tachycardia, and chills. So these are a few types of transfusion reactions that can occur with the blood transfusions. So why do they occur? The transfusion reaction occur because of the presence of antibodies, because of the presence of antigens. So the antigens are present in blood and corresponding antibodies are present in the recipient. So there's antigen-antibody reaction, as a result of which the transfusion reaction occur. So their antibodies are present in the patient's serum and in the recipient's serum, and these are incompatible with the donor cells. Now these antibodies, they attack the cells, the transfused cells, and as a result of which the transfusion reactions develop. This usually takes the form of an acute hemolytic reaction. So we have seen the hemolytic picture in which there is a rapid destruction of the transfused red blood cells. Severe ABO reactions may be fatal. So they can be fatal. So once you have established that a transfusion reaction has occurred, you need to stop the transfusion straight away. Now, it can cause complement-mediated intravascular hemolysis and multi-organ failure. So it can cause the activation of the complement system. The activation of the complement system puts the body into frenzy. As a result, there's intravascular hemolysis of the red blood cells. Intravascular hemolysis of the red blood cells causes the clogging of vessels. Clogging of vessels leads to further hypoxia and anoxia, leading to multiple organ failure, which leads to multi-system organ failure syndrome, and finally death of your patient. So the transfusion reactions from other antigenic systems are usually milder and self-limiting. ABO is the strongest antigenic system and has the strongest response when it comes to transfusion reaction. The febrile transfusion reactions are usually non-hemolytic. So the febrile are somewhat easier to contain because they are non-hemolytic. They're usually caused by graft versus host response from leukocytes in the transfused components. So the leukocytes are responsible for the febrile type of transfusion reactions. So a leukodepleted blood would not cause febrile type of transfusion reactions. Now, febrile type is associated with the fevers, chills, or rigors. So hence the name, the febrile type. The blood transfusion should be stopped immediately. Whenever you have established that a transfusion reaction has occurred or is occurring, you should stop the blood transfusion straight away. This form of transfusion reaction is rare with leukodepleted blood. We've talked about it. Leukodepleted blood is used to prevent this second type of Creutzfeldt-Jakob disease from transmitting from one patient to another. The leukodepleted type cannot cause a febrile type of transfusion reactions. Now, this diagram, it summarizes this flowgram. It summarizes the types of transfusion reactions. There are two types: the immunological, the non-immunological transfusion reactions. Now both of these types can either be acute or delayed. So the acute immunological reactions, they can be acute hemolytic transfusion reaction. We have talked about it. The allergic reaction is to any antigenic component of the blood or the blood product. Then the febrile non-hemolytic transfusion reaction, then transfusion related acute lung injury. So these are the acute immunological reactions that occur in a short while after transfusion of blood. Now, delayed immunological reaction are include the delayed hemolytic transfusion reactions and post-transfusion purpura. So, post-transfusion purpura is a relatively commonly seen. However, delayed hemolytic transfusion reaction very lethal, so should keep an eye out for that. Now, acute non-immunological reactions are volume overload. When you give extensive blood transfusion, it can lead to volume overload in the patient. Citrate toxicity, because to increase the shelf life of the blood and blood products, citrate is added to them. So giving extensive amounts of transfusion can lead to citrate toxicity. It can also cause hypothermia, because blood and blood products are stored at lower temperature, and giving blood and blood products can lower the temperature of the body further. Then there can be bacterial contamination of the needles of the cannula, and these can seed into the body cavities through the transfusion process. Now, delayed non-immunological reactions, they include the infectious disease transmission like hepatitis and HIV. You cannot have an idea of the transmission, that when the transmission has occurred, because these present themselves very late in life. So let's talk about cross-matching. How do you cross-match various samples of blood and decide what blood is compatible with the and compatible and can be given to the patient? So to prevent all the transfusion reactions, they are preceded by cross-matching. Both the ABO types and the rhesus type of the blood are matched, and only then the blood is transfused. This is done to ensure the compatibility between the donor and the recipient. Now, you mix the recipient serum. The recipient serum is mixed with the donor cells to confirm the ABO compatibility. So, in order to check the compatibility, the serum of the recipient is taken and it is mixed with the donor cells, and this tells us the compatibility in the ABO system. Or you also test for the rhesus gene and any presence of the of blood group antigen antibody reaction. So you confirm the ABO type, you confirm the rhesus type, and you confirm that there is no reaction between the donor and the recipient blood. Now, full cross matching may take longer durations of time. You usually do not have longer durations of time in massive transfusion protocols in rapidly bleeding patients. In more urgent situations, you use type specific blood. So it is only ABO and rhesus match. So you match the ABO type and the rhesus type, and you transfuse the patient before checking for any reactions between the two blood types. It can be issued within 10 to 15 minutes, and whenever the blood needs to be given in emergency, group O can be used. So group O can be used as a universal donor when there's an emergency and you need to transfuse the blood. However, once you've established the ABO and RH type, you just stop O donation and you should give the type specific blood. Now, you should always make sure that this is the blood that was issued for your patient. Two of the medical professionals should always check the labels on the blood. One of them has to be a doctor. Now, the donor serial number should match with the recipient, should match with the slip that has been given against it, so that you might ensure that the blood is given to the right person. So this was all about this section. In this section, we talked about various blood donation protocols and how do we donate blood from one patient to the other. I hope you liked and understood this section. For further sections, keep watching sqadia.com.